The health practitioners do not have a good attitude when they are serving us. Our disabilities are put first than our abilities.
Communication, limited access to specialized services for PWDs, limited number of neurosurgeons are some of the key health barriers to inclusive health access by PWDs in Uganda. Such inclusive health barriers, according to Nodipu, affect all persons living with disabilities, irrespective of the form of disability.
We do not have sign language interpreters in the hospitals. As a result of that, persons with hearing impairment struggle access or to get health services.
Even with increased awareness on disabilities, such barriers have accelerated unfairness and injustice among PWDs.
We also want to ensure that we have a situation where persons with disabilities are socially and economically empowered. But all these cannot be possible if the space is not fair, if the space is not just for persons with disabilities.
A call to action has been made on recommendations like early disability identification, provision of different beds for PWDs, reduction in the cost of assistive devices for persons living with disabilities.
For instance, we had a case of pregnant mothers who are of short stature. Climbing the bed itself is difficult. If he can climb, he will use the stomacher, which stomacher is carrying a baby.
I can walk to a hospital and all they think of who is the father of that child. Even you, as in, are you a full human being? Who is responsible for that? It's as if we are not supposed to have a right to family life, a right to be loved.
Article 25 of the Convention of the Rights of PWDs provides for the right to access of inclusive health. Persons living with disability want strategies developed to train specialized health workers to handle persons with disabilities, comprehensive rehabilitation services provided, and specialized health insurance for PWDs.
MACU, government committed the Global Disability Summit of 2022 on 27 February that it shall equip the orthopedic workshops in the country by at least 40%. Today, we see no progress.
The symposium was attended by representatives of persons living with albinism, persons with dwarfism, visually impaired, and those with hydrocephalus, among others. Susan Naonga, reporting for ABC